salut! Oh, ça va? Good. Anybody speaks Kirundi? That's almost like Kinyarwanda. Anybody? Oh, muraho! Amakuru! There you go. Anybody speaks English? All right. Yes, like they said, I'm a family physician. Very, very passionate about what I do. And it's a full story of how I got here, but I'm not going to bore you with that tonight. That's not the point. But the point is, I think like the organizers mentioned, our health, our power. If we're informed, we're able to make choices, good choices about our lives. And ignorance kills, right? So I hope tonight, whatever I speak on doesn't scare you, but it gives you the power to actually shape your intentions about your life and ask questions and advocate for yourself. I want to see, by you raising your hand, anybody who has a family physician. Anybody in the room? Okay. All right. Those who don't have family physicians. Those who claim, I do not see a doctor on a regular basis. I know, no shame, but I want to see. One, just one? But not everybody raised their hands. Two, okay, three. All right. So I want to try, hopefully encourage everybody to find a family physician. My background, before I started working here in Alberta, I was down in the USA, and I'll tell you, we are privileged in Canada to access healthcare without paying upfront, because that's not everybody's reality, right? Like in the US, you wouldn't just go to a family physician because you need money or you need an insurance. Otherwise, we have a lot of people coming to the ER because, right, they have this illness going on, and at some point they're at a breaking point, and then they're like, you know what, let's just go see a physician in the ER and they help me. But because they're overloaded too, they're not going to help you as you want them to help you. So I want us to encourage ourselves here in Edmonton, and anybody who would speak to their relative or family or friend, please find a family physician. And the good news is, you can find your family physician. If you go and, we do something we call a meet and greet, right? We get to know you, you get to know us, ask questions. If you feel like at any point, I don't feel like this is a good fit for me, it's okay to keep searching, but find somebody who you can actually call your doctor, because it's very important that you have those regular checks with your doctor. All right, my topic is on routine cancer screenings, metabolic syndrome, and heart disease in women. So let's start with the first slide. Why is women's health very important, right? This is why we're all here as women. We didn't invite any men, but why is it important? Why does it matter, right? Because we know that there is the leading causes of mobility and mortality, like different health issues, and actually death in women include cancer. That's why we're speaking on it today, metabolic diseases, and heart diseases. And early screening is going to save our lives. I can tell you so many times I've seen cases where we caught something earlier before it spread everywhere, and that person's life was saved, right? And then prevention and lifestyle. If there is anything that I want you guys to take out of my presentation tonight, is prevention is the key, right? If maybe we have some survivors in the room who've gone through a certain health issue, they know how hard it was to overcome it. And we have people who haven't survived, right, who are no longer here with us. But if you haven't had that issue, then prevention and lifestyle is going to do it, okay? Please, let's keep going. Oh, you can't hear me?
Yeah.
Do I need to put my microphone? Yeah. Okay. All right. Routine breast cancer screening. So I'll talk about three cancer screenings. The first one would be the breast cancer screening. 1 in 8 women are being affected by this, meaning we see breast cancers all the time. So what do we do in healthcare or primary healthcare is that we do something we call a mammogram or mammography. This is a specialized x-ray that can look at your breasts and actually can detect if there is any kind of chance that you could be having a cancerous mass. And then from there, we actually go through different testings. So mammography reduces death in about 20 to 30% of the cases we see. So that's a very high percentage, right? That's why it's very important that we encourage people to actually do the screenings. Here in Alberta, we recommend screening from the age of 40 all the way to 70, or actually 74. The caveat is, whatever I'm speaking on today, please, this is just for educational purposes. This is not for me to diagnose you here today. You need to have a family physician, like I said, who will take you through what you need, because every patient's case is going to be a little different. So the caveat is here that if you have a strong family history of breast cancer, if let's say you meet a doctor and they ask you about your family history and you say, my grandmother had breast cancer, and then my mom had breast cancer, or my aunt had breast cancer, that already is a red flag in my mind, like, is this a genetic cause, right? And so it's very important that you tell your family doctor everything in your family, everything in your life, because we put all these pieces together and we make a recommendation, right? So if you have a strong family history, then it's possible that you're going to need an ultrasound instead of a mammogram. It's possible that you're going to need to be screened earlier than 40. But routinely, we screen from 40 all the way to 74. And we screen every year, okay? So if you have a family doctor and you're above 40, you know that every year, if you come to us for a yearly check, which we call an annual physical, we do recommend, or we give you a requisition to actually go and do that mammogram. Some of the signs and symptoms, I tell my patients, please don't self-breast examine yourself. What I encourage you to do is self-awareness, meaning if you're taking a shower or you're moisturizing yourself and you see maybe a certain skin change around your breast, on your breast, please bring it up to your doctor. If you touch your breast and you feel like, this is unusual, right? It's painful, it might be painless, but it just feels off, please bring it up, right? But if you start self-examining all the time, you might scare yourself. So self-awareness is, yes, we've seen patients who come and like, I feel this and I feel this, and I'm strongly like, my family told me, they got an ultrasound, so I really need an ultrasound. So that might scare you. That might take you through a lot of workups that you don't necessarily need, right? So some of the signs and symptoms is if you have, like what I say, lumps or unusual masses that weren't there, or skin changes, or what we call peau d'orange for you who speak French. That means like your breast tissue or skin starts changing to an orange color, and it becomes orange yellowish, and sometimes it brings out some pus or just different discharges. That's not a good sign. That tells you need to actually bring it up before it's too late. Okay, please keep going. Then the second routine cancer screening would be cervical cancer. Anybody knows where the cervix is? Anybody? Okay, those who don't know where the cervix is? Do we know where the cervix? Are we all mothers in this room? Maybe not. Are we all mothers? No. We should know exactly. So I'm gonna teach you where the cervix is for those who don't know. We have a vagina. Do you know where our vagina is? That's a normal part of our body. I don't know why we have this. The vagina, right? If you go inside the vagina, the first part of the inside of a vagina, up there, there is what we call the cervix. That cervix is what opens up when you're going through childbirth, okay? So our cervix is a part of our internal organs. Actually, we call it a part of the uterus because that's where the uterus ends, that can typically create cancers, right? And the most common virus that causes this cancer is called HPV, okay? This is the only virus that has a vaccination. Have you heard about it?
Yeah.
HPV vaccine. So in Alberta, I think the recommended age is 26 and below. So it was never a vaccine that we recommended in our generation. It feels like maybe most of you are my age or older than me. It's a newer vaccine, maybe 10 to 15 years ago, that now we are actually recommending in younger kids around 9 all the way to 12. It's a 2-series vaccine. But if you miss that age group, we can actually get that vaccine. If you have a child who's 26 or younger, you can get that HPV vaccine. That prevents, or it prevents the most common HPV viruses that can cause this cancer, right? There is cervical cancer, there is oropharyngeal cancer, which is right here in our neck, and then there is anal cancer. All these are caused by HPV. If you're above the age group, you can discuss with your doctor and actually get it done, but it's probably going to cost you something because then the government is not going to pay for it. But it's something that I highly recommend that we all can get vaccinated for. Anyway, routinely, we do something we call a pap smear. Have you seen a speculum? Do we know what a speculum? There you go. A speculum is a little instrument, thank you, that we use in clinics or in the hospitals to actually go and visualize your cervix, right? So we visualize your cervix, and then we take a swab, we swab in your cervix, and then we send it to lab so that they can screen for this cancer, which is cervical cancer. Here in Alberta, the recommended routine age is 25 and above, all the way to 64. Now, the caveat is, again, if you've been sexually active, like you have teenagers, you need to have these open conversations with your teenagers. Like, if, they feel like they're in space of actually having sexual activity, it's important for them to know, first of all, protection is important. Second of all, STDs are real. And then the third thing is, if you've been sexually active for the past 3 years and you're less than 25, you are recommended to actually get pap smears, okay? So what we do with those pap smears, when they come back and they're negative, we repeat them every 3 years. If they're, show us any kind of skin changes or cell changes that we don't like, then we recommend further investigations that can help you. The caveat is, again, at the age of 50, remember I talked about HPV being the most common virus that can cause this cancer, we can do what we call pap smear with HPV co-testing, and that gives you a chance of doing it. If it's negative, then you repeat it 5 years later, so you don't have to repeat it every 3 years, okay? We talked about how HPV can actually prevent 95% of these cases, okay? Some of the red flag symptoms, sorry, go back a little bit. Some of the red flag symptoms, again, if you start having like vaginal bleeding that isn't your normal menstrual cycle, you need to talk to your doctor about it. It could be from the uterus, it could be from somewhere else, but you also want to visualize your cervix and make sure there are no changes there, okay? If you start having some discharge that you don't like, that smells weird or looks weird, please bring it up. Okay, if you start having pelvic pressure or pain that just isn't settling well, please bring it up. Okay, keep going, please. Let's talk about the last cancer screening that we do in women. It's called colorectal cancer. Do we know where our colons are? Okay, Our colons are part of the intestines that come all the way to the rectum, where you actually have your bowel movements, right? The poop. Okay. Strong family history is one of the things that I recommend to talk to your family physician about, because if you've had what we call first degree relative, meaning your mom, your dad, your siblings who've had colon cancer early or even late in life, then it puts you at risk. So you gotta talk to your doctor about it, meaning if, let's say, my sister was diagnosed with colon cancer at the age of 40, it means for me, I would need to be screened at the age of 30, so 10 years prior, okay? However, the routine recommended screening is at the age of 50, even though some provinces are at actually 45. That's what guidelines would say. But here in Alberta, we still start at 50 all the way to 75. What we do routinely is a stool test. We call it a FIT or FOBT stool test that we send you to lab and they collect it. If they see anything in it that needs further screening, then we do a colonoscopy. But if you've had any family history, we straight up go to colonoscopy. Or if you come, some of the red flags that I would like for you to know, if you come to a doctor or actually you're at home and you just poop and you see blood in stool, that's not a good sign, okay? That's something to say, I need to talk to my doctor about. If you have chronic constipation that just doesn't go away, even with high fiber foods in your diet, or exercise, and you just still feel like, I don't feel good, I feel bloated, I feel like, constantly I'm not emptying my rectum, that's not a good sign. That's something that we need to talk to our doctors about. All right. Yeah, managing cancer risks. So this is an overall slide, and we've talked about this, is that family history is very important, right? Discuss with your family doctor. It might determine earlier screenings than the routine screenings that we do. Be proactive, okay? Go to your doctors. I know it might feel like you're going out of your way, right? It's not something you probably, we come from different cultural backgrounds where you feel like, I don't want to expose myself. I feel shy about talking about my vaginal discharge. They might think that I'm not hygienic enough. That's not the case, right? The first thing you need to know that, we are held by ethic conduct, right? Professionalism is very important. If you feel like the doctor has crossed that line, it's important that you report that. But it's important that you feel like that's a safe space for you. Talk about anything and everything that bothers you, because there is always a solution that you don't know about, okay? And then maintain a good weight. What is a good weight? Healthy BMI is said to be between 18.5 all the way to 25, and I acknowledge that can be a biased objective, meaning we African background descent or Caribbean or different cultural backgrounds, this BMI can be a bit biased because some of us are short, some of us just have, we're curvy, and that BMI might not fit us. But the point is not the number. The point is you gotta make sure you're living a healthy lifestyle. That means we're eating healthy, okay? We're eating all the nutrients that are needed, and we're eating with portion control. You don't always have to finish your plate. You don't always have to finish your plate. You don't always have to finish your plate. And then be consistent with exercises, right? I'll talk about that more later. Okay. Some of the tips on prevention and early detection of breast cancer. I feel like I'm repeating myself, but please have a family doctor in place. Very, very important, okay? Physical activity. What the American or Canadian Association of Cardiac Association, they recommend 150 to 300 minutes per week of more moderate intensity exercises, meaning your heart rate, if your regular heart rate is maybe at 80 beats per minute all the time, it needs to double, right? So that's why you know that actually I'm doing a moderate intensity exercise, okay? So 150 to 3, if you divide 150 minutes per 5 days, which is 5 days of a week, right? Take 2 days out. That gives you 30 minutes of physical activity every day, okay? And you know, you talk to patients, they're like, oh, my job requires me to walk all the time, or my job requires me to lift, you know, I'm always like physically active. That's not exercise, honey. And I think somebody said it, as mothers, we think about everyone else in our lives and we put ourselves on the back burner, okay? So that has to change tonight. Remember the exercises we did? What is your intention? What do you want to take out of here tonight? If there is anything that I recommend, and something that I told myself included, is that I need to be consistent with my exercises, because I'm not. Yeah. That's the honest truth. But if you're consistent with your exercise, even 20 minutes, if you don't go by what I'm telling you here, but you start off even with 10 minutes in your home or outside, the weather is beautiful, or at the gym, whatever you can, but make those 10 minutes about you, because you cannot give from an empty cup, okay? All right, sorry, go back a little bit. Alcohol avoidance. Alcohol is the most, what's the word I'm looking for? The most acceptable drug in society. And you know, we can debate this, you know, with our religious backgrounds. That's not the point. The point is, this is research-based, that there is no safe amount of alcohol in our bodies anymore. We used to say 1 glass per night will help you sleep. That's all BS. It's no longer a thing. If you are to drink alcohol, because again, it's socially acceptable, 1 glass per twice a week is what we call low risk, but there is still a risk, okay? So just reevaluate yourself. If you're an alcohol drinker, please remember there is a risk to cancer, okay? And then we talked about weight management, and then in breast cancer, what we've seen is that plant-based diet is what is going to help us with prevention and management, right? If you've been a breast cancer survivor, I'm sure you've been told plant-based diet. And it feels like now it's an ongoing awareness that is in society, that everybody's caring about what we eat. We used not to care about it, right? You used to drive by McDonald's and buy for your babies and feel like, okay, it's okay for me to eat these things, right? But no longer that anymore. Everybody seems to be, you know, thinking about what we eat. It's very important to know that if you're gonna eat and enjoy food, make sure that those calories are counting in your body, okay? So plant-based diet, meaning vegetables, all sorts of vegetables, fresh produce, fruits, whole grains, and healthy fats. Keep going. Okay, some of the tips on prevention and early detection of colon cancer. Again, physical activity, very important. I think we talked about that. And then diet, again, I think here, the most important thing to remember is high fiber diet is very important in anybody who's had problems with constipation or early detection of colon cancer, or even anybody who's just a normal human being. High fiber diet helps you to go to the bathroom without a problem, and even more beneficial with other things in your body. Okay, red meat and processed meat, that's a no-go if we're preventing colon cancer, okay? So if you're to eat meat, I recommend lean meat, white meat, that is chicken, that is turkey. What else? Meat eaters. Fish, thank you, seafood. There you go. Smoking cessation. I can't emphasize this enough. Smoking is one of the biggest killers in the world today. So smoking cessation, alcohol limitation or none, and weight management, okay? Okay, let's go to the next topic. What is metabolic syndrome, okay? Metabolic syndrome is a cluster of different risks that can lead to what we call heart attacks or strokes. Those include high blood pressure, what we call hypertension, That includes diabetes, that can be type 2 a lot of times, but type 1 included. That can mean elevated cholesterol and belly fat. Some people naturally have belly fats, right? But others, this belly comes from lifestyle, right? And so if you start having increased belly fat on a very increased acceleration, then maybe you need to question that. This is not healthy. This is going to cause bad health outcomes, right? So again, that's why it's important to have a family doctor, because when you come for those regular checks or yearly physicals, what we include in the blood work requisition is always looking out for these things, right? Is your cholesterol normal? You'll never know until you do the check, right? Is your blood pressure normal? You'll never know until you come to your doctor. Are we diabetic, or are we at risk of diabetes, right? All these things are done at the doctor's office. Okay. Some of the warning signs to watch out for. Sometimes there are no particular signs, right? Blood pressure is a silent killer. Sometimes you see patients just walking normally and all of a sudden they have a syncope or they just black out. Why? Because their blood pressure is in the roof and they have a stroke. So sometimes there are no warning symptoms at all, and that's why it's very important to actually have a regular doctor that you go to. Again, I talked about this. If you start having an increased waist circumference that you didn't have before, and it's just increasing at a very faster pace, please, something to bring up and be aware of. Persistent fatigue and low energy. It feels like all mothers are always tired, right? Yeah, you kind of got to evaluate yourself and think is this because I'm not taking care of myself? Or is it because there is something else going on, right? I'm still sleeping, I'm still, working, or, going on a walk, or, whatever self-care means for you, but you still feel that low energy. That's not normal. That could mean so many things going on in your body. Elevated blood pressure readings, that could be a sign of something else going on. And then difficulty managing your weight regardless of doing everything possible. That's also not normal, right? How do we prevent and manage metabolic syndrome? Again, it goes back to lifestyle changes. If there is anything you'll take out from my slides today, please, lifestyle is the key. Lifestyle. So exercises, eating healthy, managing your stress, and managing your weight, okay? So removing processed sugars, processed foods, preserved foods, fast foods, high oils, those kind of things, okay? Let's keep going. I feel like I've talked about that so much. Okay, heart disease. Okay, heart disease is a very big topic. I don't think we can cover it all tonight, but a few things that I want for you to be aware is that it's the leading cause of death in women, okay? And when we say that, we mean that there is what we call a heart attack that kills. There is what we call heart failure, right? And there is what we call coronary artery disease, where you might not have a heart attack, but you still have that chest pain, and that can lead to some blockages in your arteries in your heart, and that could lead to stenting or open heart surgery, different things that are not good health outcomes, okay? Some of the signs and symptoms of heart disease, unfortunately in women, heart attack presents a bit atypical or differently with what normal heart attack symptoms could be. So regular or normal heart attack symptoms could be left-sided chest pain that radiates to your left arm or shoulder or neck, right? That's what we see a lot of times in men. However, in women, because we have different things, we have hormones raging, different things in our bodies, sometimes it presents as nausea, right? You feel weak, you feel nauseated, you feel like you're dizzy, you feel like you're about to fall down, or finding yourself that, when you're lying down, you just cannot catch your breath. And some people start using different pillows, okay? If you start feeling like that, like you never needed pillows before, but now lying down, you feel like I need to add an extra pillow, and the following night an extra pillow, that's not a good sign. Cold sweats, lightheadedness, dizziness, and all that. In prevention and management, it goes back to lifestyle, it goes back to exercises, it goes back to eating healthy and controlling metabolic symptoms, regular checks, and take our medications as prescribed.